As the warm weather months settle in across Ontario, more people are heading outdoors to enjoy hiking, camping, and backyard barbecues. But alongside the sunshine and fresh air, there's a less wanted seasonal visitor making an appearance: ticks, and lots of them. Experts are sounding the alarm as tick populations, particularly black-legged ticks, also known as deer ticks, continue to rise across the province. Thanks to milder winters and longer spring seasons, ticks are not only surviving in greater numbers, but also expanding into new regions, including urban parks and residential areas. With the increased risk of Lyme disease and other tick-borne illnesses, public health officials are urging Ontarians to take precautions. Earlier, I sat down with Dr. Abhishek Raut, medical director at Appletree Medical Group, to discuss the increase in ticks this season and the health implications that come with it.
Dr. Raut, thank you so much for joining me today.
Thanks so much for having me.
Now, what health risks should people be most aware of when it comes to ticks?
Well, ticks may be very tiny, but I think the health risks can be quite serious, especially because their range is expanding across Canada. Now, the most common illness for ticks is Lyme disease, which is caused by a certain bacteria, and it's transmitted by the black-legged tick. But beyond Lyme, we do have ticks transmitting other infections like anaplasmosis, babiosis, and Powassan virus as well. And some of these, like Powassan virus, are actually rare, but still life-threatening. And so you can have symptoms ranging from seizures to even brain inflammation there. So in Canada, we have about 40 different species of ticks, and only a few of them are known to transmit a disease to humans, but their populations are still growing. And really, the active season now stretches from early spring all the way to late fall, and in some areas, even in the winter as well. So while they might seem like a minor nuisance, there is a large public health implication here for ticks.
And how can people protect themselves, especially people who enjoy spending their time outside?
Dressing smartly is the most helpful here. So wearing light colored long sleeve shirts and long pants, and importantly, tucking your shirt into your pants and then your pants into your socks. That creates a protective layer against ticks. Of course, closed-toed shoes are very important. And now in Canada, we can also get certain clothing or repellents that will avoid ticks in general. Permethrin-treated clothing or even DEET repellents are very helpful as well. And then what I would recommend certainly is staying on the trail, so not going right into the bushes there. And then as soon as you come back home, what you would want to do is shower within 2 hours and do a full body tick check. And that way, if there is a tick that happened to hitchhike with you, you're able to find it right away.
Now, if a tick is attached to someone, usually the first reaction is panic. But what should someone do if they do find a tick attached to them?
Exactly right. So the first thing you want to do, step number one, is to stay calm. What we want to do is get that removed in our best possible way. If you can see a physician right away, that would be great because they can do that for you. But if you're in an area where you're not able to see a physician in a timely manner, then you would want to use a fine pointed tweezer and bring it as close to the skin as possible, just taking it and pulling the tick straight up with steady, even pressure. So you don't twist, you don't jerk, you don't squeeze the tick's abdomen, just a steady, even pressure. If certain areas break off, that's fine. Don't dig for them, just leave them alone. They'll be expelled naturally. And whatever you have remaining with the tick, what you'd want to do is keep it in a plastic bag or container and store it. So as soon as you can see a healthcare provider, you can explain what's happened and they can do the necessary testing if needed.
Now, ticks and Lyme disease usually go hand in hand, but what is Lyme disease and what are some early symptoms that people should look out for?
So Lyme disease is an infection that's caused by a spirochete bacterium, the Borrelia class there, and it's transmitted with the bite of an infected black-legged tick or a deer tick. So what we do see is once it spreads into a bloodstream, it does cause a spectrum of different illnesses, from localized skin changes to even multi-system effects. Early signs, so we're talking about 3 to 30 days after bite, you'll usually see a rash. We call that erythema migrans because it looks like a bull's eye rash. You'll also see flu-like symptoms and even swollen lymph nodes next to the tick bite there. What we try to do in medicine is, as soon as the tick bite is present, we try to give an early antibiotic treatment, which is highly effective, and it can really prevent any of those sequelae or development of full Lyme disease as well.
And what are other illnesses that people can get from ticks? You went over some of the diseases and stuff, but what about illnesses?
Yeah, so I think when we think ticks, we think mostly of transmitting infections, but there's a variety of other issues that we do see with ticks as well. There's skin irritation and secondary infections. So a lot of people will actually get quite significant local inflammation, intense itching, and even a skin infection or a bacterial cellulitis. We also have started to see recently developing hives and an anaphylactic reaction, which is becoming more common. And certainly in some areas, you get these single bites that can later lead to what we call alpha gal syndrome, which is a very delayed syndrome that actually makes you allergic to red meat. And that can last for several months as well. So quite a few different things happening with ticks aside from just infection.
It's been recommended that if you find a tick attached to you and you remove it, you should keep the tick and take it in to get it tested. Do you agree with this recommendation?
So it's interesting because I think the first priority still is safe removal of the tick. So if you want to keep the tick, but not on you, that's okay. But the first important priority here is to get the tick removed from you. Then we do have identification of ticks as well. So in Canada, you can store the removed tick in a sealed container or bag, and then you can bring it either to your healthcare provider or even a public health unit, and they would do some identification for you. Oftentimes that takes several weeks as well. So you don't want to delay treatment just for the identification. It's just going to help you later on when we know that everything's okay.
And does a tick being attached to someone for a certain duration affect the illness that they could get, or if they are going to get an illness at all?
Yeah, so what we do know is the longer a tick remains attached, there's a greater chance it can transmit certain pathogens, especially that bacteria that cause Lyme disease there. What we do see with that is the risk of transmitting Lyme disease is extremely low if you remove the tick within 24 hours. But it starts climbing pretty sharply after 36 to 48 hours and really reaching its peak then. So we've seen a lot of studies in North America and Europe that bites shorter than a day carried about a 5% transmission risk, whereas if you had it beyond 2 days, it was a significant likelihood. Now, that's just for Lyme disease. A few of the other diseases, actually, you do find that they can spread it. Powassan virus, for instance, that can be spread to the host within minutes. But for the most part, the sooner you remove the tick, the more advantageous it is.
Dr. Raut, thank you for the time today.
Great. Thanks so much for having me.